How many in this room would like to live to be 135 years old? How about if I were to tell you that that life would be free of pain and suffering and free of a lot of the afflictions and ailments that contribute to sickness, illness, and a compromised life? That time is now. Science is at the point now where we can reasonably expect 110, 115, 120-year lifespans, but it doesn't come easy and it doesn't come free.
The first person to live to 135 has already been born. Will it be you? And then we kind of use that as a segue to patient and physician discussions about what's possible in the world of testing and treatment in medicine. Just look at it. We didn't even know the makeup of our genes 30 years ago, 35 years ago. And now they've been sequenced. And not only have they been sequenced now, but it can start to associate genes with particular disease states. So there's a stress hormone called cortisol. It's something we naturally make, and it is one of the hormones we create when we need to engage in a fight or flight response. We're designed as humans to only occasionally be threatened. We were only infrequently stressed. Modern life is stressful from the moment you wake up, in the best of circumstances. And eventually you get into a situation where cortisol has been so heightened for so long that it just doesn't work anymore. You don't make it as much of it. So cortisol's effects is to put sugar in your bloodstream so that you can fight the lion or run away from it. It's kind of what functional medicine does, is we look at the person in its entirety. And I've gotten a lot more information from that approach than just having somebody come and say, these are my constellation of symptoms. What's the one thing you can fix? And it doesn't work like that.
So let me tell you a little bit about how our minds work. And when I say our minds, I mean physicians. You come in with something called a chief complaint. This is important to you. It is the most obvious manifestation of the problem that you're experiencing, whether it is the hot flashes, whether it is the mood swings. In males, whether it's inability to work out in the gym anymore. But what's really going on behind the scenes and what we're cracking the code on is the underlying problem that's causing these symptoms. So finally, we've achieved that point in medicine where we've taken what afflicts men and women and demystified them, and now are able to address these problems and similar ones through hormone replacement. Behind the scenes, in ways that we as physicians should be concerned about, it's other things. Things like bone density, heart protection, protecting your brain. There's receptors for hormones throughout our body that do different things. It's not all about what's below the waist. We were designed hundreds of thousands of years ago to live a life that meant a fairly basic routine. Waking up early in the morning, finding our food, hunting our food, and if we were lucky enough to catch that or kill that gazelle, to drag it to our homes, cook it over an open fire, and eat it the same day that we caught or killed it. Do you notice that I never said preservatives? Did you notice that I never said pesticides? Did you notice I never said various toxins in the environment? That's how we were designed to live. And if we live the life of a modern world, we're surrounded by things that want to make us sick, that want to kill us, and that want to shorten our lifespan or significantly compromise the life that's possible. Another point I'd like to make is the importance of genes. Genes are things that we are given, but not all genes are expressed. You want to turn some genes on to derive their benefits. You want to turn others off so that you can perhaps stop a cancer from developing to begin with. One of the popular ways is red light therapy. Does it really work? In a word, yes. But that light has to be in the proper wavelength, at the proper energy, so that you derive the benefit from it. So do the products from Amazon work? Probably not. Frequently, they're underpowered and they're at the wrong wavelength. They're little more than LEDs. You hear the buzzwords all over the place. Functional medicine, anti-aging medicine, as if there was a magic pill that can take away all the ills of a world that is not designed for the way that we were. It's not like that. It takes some investment of time. It takes some buy-in from you as patients, and we as scientists will help you with the rest.